We are talking about type 2 diabetes. If you're struggling with shots and tracking your blood sugar, you are not alone.
That's right. We're here with Dr. Shumard, who treats type 2 diabetes and helps his patients get their lives back. Welcome in. You're here from San Diego. Welcome to Nashville.
Thanks for having us. We're excited to be here. Yeah.
Awesome to have you. Now, I know it was a personal story of your mother's struggle as being a diabetic that ultimately got you in this path. Do you mind sharing a little bit about that?
Absolutely. When my mom was diagnosed, I thought, like many other individuals, totally treatable, lifestyle, change your diet, etc. But as time passed, she kept getting worse and worse. And I was concerned. I'm like, I got to figure something out for her so I can do something. I researched this, started getting into more educated about type 2 diabetes, and saw there were solutions that could be done to actually reverse type 2 diabetes. The problem was, when I presented it to her, she was not interested. She was doing fine, like most diabetics. And as she progressed and got worse, it wasn't until a point where she went to full-blown kidney failure dialysis when she finally reached out. And the hardest thing you ever have to do is say you can't help. It's just too far, right? And unfortunately, within 8 months, she had a stroke and she passed. So from that moment on, I really put a fire, if you will, under me to like, I have to help as many people as possible. I can't let this go on. And so we've really been promoting this to individuals to know, hey, you have an option, you have a choice to fully reverse this. Our patients get off medications, they start living their life again, and they reduce the progression of diabetes that so many are experiencing.
Wow, I'm sorry for your loss, and I'm glad you're doing this work to turn it around.
And we know your mom is very proud of you.
Yeah.
I gotta ask, let's start from the beginning. What does that diagnosis look like?
Yeah, typically for most people, they have no clue they have diabetes. They're just thinking they're doing fine. They go in for a typical checkup, maybe a life insurance policy or a yearly checkup with their doctor, and it's next thing you know, like, hey, you have type 2 diabetes, and they're just so perplexed. Like, what do you mean? I feel fine. But it's that diagnosis that finally starts to put them down that avenue. They start taking medication, start making some lifestyle changes, but unfortunately, we know diabetes is a progressive disease. So these individuals get worse no matter what, and it's mainly because the focus is on the symptoms and not truly what the cause is.
And that's what you focus on, is the cause. Tell us how you help those folks.
Yeah, so when you look at diabetes, it's actually a cellular disease. Most people think it's a sugar disease, but our cells, which is our, you think of glucose or sugar, it's our fuel. Like you put gas in your car to go down the road, right? And it has to get to your engine. Well, our cells are our engines. That's where everything has to get to. But unfortunately, in diabetes, the cells are clogged, or you can't get the sugars in. So when enough of those cells are damaged, where do the sugars go? Back into the bloodstream. And so we deal with this high sugar situation. But the problem is there are so many components that can cause cellular damage. So we do comprehensive testing, way more comprehensive than typically an individual does. We'll look at hormones and more advanced testing on a blood test, maybe GI tests and things. We can see what problems the person's experiencing that are contributing to their cellular damage, and we start to focus on those, start unraveling those problems, and start creating solutions for them. So not only to start feeling better, but we're not even doing anything else except for fixing those problems, and their sugars start going down. And next thing you know, their doctor's taking them off medications. They're feeling better. They're reversing their condition and being able to live the life they really want to live.
Wow. Yes, I love how you say you provide customized solutions, and I know this is all fueled in doing what you wish you could have done for your mother.
Yep.
What signs and symptoms should we be on the lookout for before we go to the doctor?
Yeah, so oftentimes you may have things like fatigue. Maybe you're starting to gain weight, even though you're not really eating more, or you're not doing anything different than your life, but you're starting to see some brain fog, just things changing in your life. They call it metabolic syndrome, because the person starts to get a little bit belly fat, brain fog, sleeping issues, fatigue. And oftentimes people think, well, I'm getting older. It's part of the process. With females, they say, well, I'm going to menopause. It's like normal type things. These are not normal type things. There's usually some sort of problems or functional issues that are going on in the body. And if evaluated appropriately, you can catch those early and not have to go down that path ever again.
And it can impact anyone, any age.
Yeah, absolutely. I mean, normally with type 1 diabetes, that's usually younger kids, and it's a whole different mechanism. It's typically an autoimmune where the pancreas is no longer able to produce the hormones that are for blood sugar regulation. But type 2 is an acquired one, and it takes time typically. But people as young as 18, 20 years old, all the way up until the 90s, can get diagnosed with this condition.
But the best part is you can help them out. Thank you so much, you, doctor.
Yes,
yeah,
thank you.
Yes.
All right, take control of your health and talk to Dr. Shumard today. Visit him at
Shumard.com to learn more about his 30-day diabetes reset.